Hello, I'm Dr. Warren, and today I want to run through what to do if you just got bit by a tick and are worried about Lyme disease. So if you just found a tick, what should you do? Now, the first thing to remember is that not all ticks have Lyme disease. The studies can really vary, but we generally consider about 15 to 25% of the ticks, if you get bit, have a disease like Lyme disease being the most famous. So there's a decent chance if you got bit and you don't feel ill, that it wasn't infected and you'll be just fine. What you want to be on the lookout for is if you develop any abnormal symptoms. The classic symptom that's a dead giveaway is that bullseye rash. However, at least half the people don't get that bullseye rash. So if you get a headache, a stiff neck, arthritis, flu-like symptoms, fever, or abnormal neurological symptoms following being outside or being camping or being hiking or finding a tick on you, then we're going to want to take action if you develop those kind of abnormal symptoms after you've had kind of normal outdoor exposure, or if you find a tick directly on you. If you're feeling sick, the standard recommended therapy of antibiotics helps about 90% of the time, and is what we absolutely recommend you go to your doctor and do. Standard antibiotic is doxycycline. There's a few alternatives, but that's the one that's recommended. And that if you have the rash, the duration is 10, maybe 14 days. The neurological symptoms, you want 14 to 21 days. And if you have the arthritis symptoms, they recommend about 28 days. Just remember, if you get sick following a known tick bite or an outdoor exposure, your doctor has full authority to treat you based on your symptoms, the history of where you've been, your exposure, and they're supposed to be using testing as confirming, but they do not need the test to be positive in order to do standard treatment. And this is posted right on the CDC website and is following IDSA guidelines. You should be all better by the time that's done. And there's about a 90% success rate, as we've said, so that's the good place to start. Where I'm getting this 90% success rate from is a 2022 study from Johns Hopkins, which can be found on the Johns Hopkins Lyme website. And they took 200 some patients who got diagnosed in the first 30 days and got antibiotics within the first 30 days. Now, this is the most ideal of all circumstances. And what they found was 90% of people got better, but 10% of people went on and developed chronic problems. And we know that Lyme can cause chronic problems. And because of this risk for Lyme developing into chronic, we want to be more proactive during this specific time frame, because it's much easier to help you get rid of Lyme right away than it is to try to battle it once it's gone chronic and deeper in your system. Because the standard round of antibiotics is effective 90% of the time but fails 10% of the time, we recommend, because we don't want to get into that chronic Lyme mode, that you couple the medical treatment with natural supports that can enhance your body's ability to heal. The key things we're going to recommend are garlic, neem, and a multi-strain probiotic. Let me run through why I recommend each one and how it can enhance your body's ability to beat this and just recover and go on with your life. So garlic is something in a 2018 study that came out as very effective against Lyme. And a key component is it gets through Lyme's biofilm very effectively. And a biofilm is something Lyme does to try and protect itself against both your immune system and any antibiotic attack. So by using garlic, we can help up the ante on trying to get rid of Lyme. Now, garlic particularly was something that I had trouble with in the clinic because we went through several versions of it before we found one that was very effective. And this kind of highlights one of the reasons why Dr. Paul and I started NutriRestore, is we found out when we got into practice working with real people that not all supplements are created equal. And particularly in the herbal world, we had more quality control problems than even just dealing with other nutrients. And when we went through garlic, we found this one to be very potent and work very well. Whereas other ones we tried, we did not get the same results with patients in our clinic in. And so we found that high quality control, extraction processes, making sure that what's in the bottle and on the label are matching and reliable is extremely important in the herbal world. Also, the counterfeit supplement industry is a huge problem online. And so we wanted to make sure we could bring you products that were reliable, that were potent, and that we knew we could count on based on our experience in our clinic. So NutriRestore is where we bring this to you, try to make it easy and with things that we know can be relied on. Now, the second product that I want to highlight is neem. Now, neem is an herb that is particularly important because co-infections come with Lyme. So ticks do not just have Lyme by itself, and they carry bacteria, parasites, viruses, and the standard antibiotic courses don't do a lot if you got parasite or a virus along with that tick. Neem is terrific for your body fighting parasites and fighting viruses, so it gives you a broad range of coverage in case you got something that's not quite as famous as Lyme, but still causes quite a bit of problems. And so neem is a wonderful herb to help your body when fighting both parasites and viruses, which are a possibility when you're getting a tick bite, and just gives you a better coverage in case you picked up one of those co-infections without knowing it right alongside the Lyme disease. The third formula we're going to recommend is a high-dose multi-strain probiotic. The number one problem we run into in our clinic when people do antibiotics is the antibiotics affect our gut flora in a negative way. And a high-dose multi-strain lacto and bifidobacteria probiotic has been the best, healthiest thing we can do for your gut while you're doing that medical treatment in order to help the gut maintain its health and keep your system vibrant and healthy. We would recommend probiotic anytime we have to do an antibiotic, and this is no exception. Frequently asked questions that I run through are, can you take the antibiotics and the herbs all together? And the answer is yes. This is designed to be taken alongside any medical treatment that your doctor recommends. In fact, if you've been acutely bit by a tick, we highly recommend you talk to your doctor and follow the IDSA guidelines or the CDC guidelines. They're good when we find it acute. 90% success is good, but a 10% failure rate is still a significant number, and we want to be proactive during this key time of your health when dealing with Lyme disease. It is so much easier to handle this on the front end and just be a little more proactive than have to fight chronic Lyme later. So we highly recommend doing a little more proactivity than just the standard medical treatment in order to try to avoid being someone who has to fight with chronic Lyme in a longer, harder way. Another question I get is, what are common side effects of this? We don't typically get side effects on this kind of a protocol, but garlic for some people can cause heartburn. Sometimes short-term antacids can help for the month that you're going to take this, because we do recommend you take this for about a month right alongside any medical treatment. Now, also, you can lower the dose of the garlic if you get heartburn to a dose you can tolerate. Now, another question I get is, does the garlic smell? Yes, we've talked about this, but I've gone through different versions of garlic, and the quality control on garlic, particularly when it smells a little bit, we find it to be much more effective. I've used several deodorized versions and always found them to be inferior. We do recommend a mint. You will notice that the garlic smells a little bit. Just know that that is part of its potency and part of its effectiveness. And a mint, if you're going to kiss anybody, is a good idea. In closing, if you just recently got bit by a tick, we highly recommend you go to your doctor and get that standard CDC recommended course of antibiotics that's 90% effective. We also recommend you couple that with our key ingredients, our garlic, our neem, and our high-dose probiotic in order to be more proactive during this time. Just get rid of the Lyme so you don't have to fight it chronically. I'm Dr. Warren. I hope you found this helpful.